Connect, commit, act. The Global Disability Summit, Thematic Pre-Summit on disability inclusion in the health sector.
A film with different people with different disabilities from different cultures all over the world.
You're such an inspiration.
So brave.
You remind me to be happy.
I love that you don't let it get you down.
Good for you.
It breaks my heart.
Look at you out and about.
You push us all to do better.
You are superheroes.
Really?
Yeah, we're superheroes, all right.
For getting the kids out the door on time.
We push strollers.
Io sono il passeggino.
We break phones.
But there's nothing special about us. We have mortgages.
Listen with duvets.
Watch reality TV.
Pretend we're watching reality TV.
We're politicians and lobsters. Pension advisors.
We get married. We met on a blind date.
We laugh at ourselves too.
We love our grannies.
And our go-go's.
We pray 5 times a day. And no, I'm not praying for a cure. I'm praying for a new handbag.
We swipe right. We go on first dates.
And get lucky too.
So are the pedestals are nice.
And the pity tolerated.
We're not special. That's not what it's like.
Non è la nostra realtà.
And only when you see us.
Wonderfully ordinary.
Wonderfully human.
Only then
Can we all break down these barriers?
That keep us apart.
That's 1 billion people.
Welcome to the pre-summit meeting for the Global Disability Summit 2022, brought to you by the governments of Norway, Ghana, the International Disability Alliance, and the WHO. We are going to be focusing on disability inclusion in the health sector for the next 2 hours. Our program is packed. We even have a 1-year-old contributing. I know you're wondering, how is that possible? You'll have to stay for the whole 2 hours to find out how that works. We have discussions, we have music, plenty to keep you engaged for the next 2 hours. My name is Femi Oke. I am your moderator and meeting guide. So let me start with this player. At the top of the player, you will find 2 sign languages: International Sign Language and American Sign Language. We also have closed captions and interpretation in 6 UN languages. You will hear from all of the co-hosts during our entire program, but we get started with the International Disability Alliance Chair, Yanis Varadkastanis. Yanis, so good to have you here. How would you like to begin?
I will start by wishing you all happy, healthy, and safe New Year. Let's hope that next year, this time, COVID-19 would have left us. That's the way I would like to start. And let me now introduce my presentation to you. Ensuring disability inclusion in the health sector is a political, a moral, and a legal imperative that must be advanced as a matter of priority around the world. It is critical to ensuring the right to enjoy the highest attainable standard of health of persons with disabilities on an equal basis with others. Persons with disabilities have historically faced and still face significant and systematic discrimination and barriers in accessing health goods, information, and services. The normative framework is very clear. The right to inclusive equality in all areas, including health, is very well established by the CRPD and the jurisprudence of the committee. These legal obligations are reinforced by a range of political commitments including the political declaration on universal health coverage. The aspirations of this declaration made towards the end of 2019 is in sharp contrast to the harsh realities of the few years past with the COVID-19 pandemic. Both historically and during the pandemic, the reason that health sector was not providing inclusive services was because it was not consulting with organizations of persons with disabilities, reflecting a very deep systemic failing and with tragic consequences. The COVID pandemic positioned access to health as a core priority of the disability rights movement, and central to this is the meaningful consultation with OPDs. Now, more than ever, if we want to be ready for a new pandemic, we need to ensure that disability inclusion in the health sector becomes a reality. This can only be achieved by consultation and collaboration with OPDs. 2022 is a timely juncture to reflect on progress and strengthen political commitments on disability inclusive health. There is excellent technical guidance from the World Health Organization and from the reports of the UN Special Rapporteurs on the Rights of Persons with Disabilities. The 74th World Assembly resolution on the highest attainable standard of health for persons with disabilities provides a very strong foundation for collaborative efforts with organizations of persons with disabilities and the health sector. Undoubtedly, there is a global urgency and a global recognition that the time is now to see things differently. The time is now to be inclusive in the provision of our services. The global COVID-19 pandemic has shown to us more than ever before that we are all connected. It has also highlighted the devastating inequalities faced by persons with disabilities. We must do more to include the world's 1.2 billion persons with disabilities in the health sector. Now is the time to commit to change and make our world more inclusive of persons with disabilities. The Global Disability Summit 2020 is a great opportunity for all of us to make progress towards a world where everybody is included and can access her human rights. The International Disability Alliance looks forward to the years ahead of OPDs being fully included in policy design and implementation, driving research and innovation, ending social inequalities, and helping realize the right to inclusive equality, and the right to health for all persons with disabilities around the world. Nothing about us without us. Thank you for joining us today.
Thank you so much, Yanis. If you're watching right now, you've already made a commitment. You've registered, you've logged on, you've blocked out 2 hours. Thank you for doing that. What is the mission of this meeting? I'm going to give that explainer to another co-host, Norway. Welcome to the Prime Minister of Norway, Jonas Gahr Støre.
Excellencies, ladies and gentlemen, friends, it is a great pleasure for me to welcome you to this pre-summit on disability inclusion in the health sector. This pre-summit is a stepping stone to the second Global Disability Summit in February. The first Global Disability Summit in 2018 succeeded in placing the issue of rights-based disability-inclusive development higher on the international agenda. That was much needed. I firmly believe that inclusion is a prerequisite for sustainable development, and it is essential for individuals to be able to influence and take responsibility for their own lives. As co-hosts, we will build on the progress made in London in 2018, and we will broaden the agenda. Health is a good example in this context. In many low and middle income countries, persons with disabilities are among the most marginalized people in the world. They are also often the last to gain access to healthcare. This is why we have chosen disability inclusion in the health sector as the topic for this pre-summit. We know that disability and poverty are mutually reinforcing. The pandemic has compounded the situation for marginalized communities and people. We must take steps to safeguard the health and well-being of persons with disabilities, including mental health. Health issues have an impact on many areas of life. For instance, poor health negatively affects people's ability to gain an education or find work. Similarly, lack of access to education or employment affects people's ability to access healthcare. This highlights the need for a holistic and inclusive approach. Dear friends, we expect the Global Disability Summit to lead to concrete political commitments. Commitments that will advance the implementation of the UN Convention on the Rights of Persons with Disabilities and result in genuine change. Some 15% of the world's populations live with disabilities. Improving their lives will have significant impact for individuals and for society at large. To make this happen, we are seeking close collaboration with a wide range of actors, including civil society, organizations of persons with disabilities, multilateral organizations, as well as governmental and private sector actors around the world. And of course, all of you participating today. We welcome and encourage new commitments both relating to inclusive health and in other areas as well. We need to join forces to raise the bar and secure new ambitious commitments in the time leading up to the summit. We look forward to cooperating with you all in the run-up to the summit. Together, we can bring about real change for persons with disabilities. Thank you, and the best of luck.
I love that the Prime Minister of Norway wished us the best of luck. Thank you, Prime Minister. Great to have you. So I'm going to go live now to Geneva, where the Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, is waiting to give us some wisdom. Dr. Tedros, what would you like to share at the opening of the pre-summit meeting for the Disability Summit 2022?
Thank you, Femi, and very glad to see you again virtually. and Happy New Year. Your Excellency, Prime Minister Jonas Gahr Sture, Your Excellency, Minister Kwaku Ajaman Manu, Your Excellency, Nitsan Horowitz, and Yanis Verdakstanis, Dr. Natalia Kanem, Excellencies, dear colleagues and friends. Disability is part of the human condition. Persons with disabilities contribute to the diversity of our communities. Many of us either experience some form of disability ourselves, or we have a family member or friend who experience disability. But far too often, when they seek out health care, our brothers and sisters with disability are being left behind. I think the Prime Minister said it nicely. The most marginalized are actually people with disability. The barriers they may face are numerous, including the physical environment of health facilities, the attitudes of health workers, or the communication of health information. During the COVID-19 pandemic, persons with disabilities have been disproportionately affected by the disease itself and by the public health and social measures taken by governments. This is unacceptable. It's also largely preventable and addressable. Achieving health and well-being for all must include addressing the barriers that prevent people with disabilities from accessing the health services they need. Removing these barriers benefits everyone, especially vulnerable populations, older people, people with temporary limitations, or those living with chronic conditions. Recognizing what needs to be done is only the first step. The second step is committing to building a disability-inclusive health sector that makes it easier for people with disabilities to access the health services they need and works with other sectors to foster greater inclusion in society more broadly. For this, I would like to acknowledge the leadership of the governments of Norway and Ghana and the International Disability Alliance. Through your commitment and foresight, health is a thematic priority at the Global Disability Summit that will take place next month. As Prime Minister Sture mentioned, the Global Disability Summit is a powerful opportunity to bring the international community together to commit disability inclusion. I urge all of you, honorable ministers, partners, and stakeholders to commit to creating a disability-inclusive health sector by implementing the 10 health commitments of the Global Disability Summit. They are commitments that will contribute to making universal health coverage truly universal. The third step and most critical step is to action. That requires us to listen and engage in a continuing dialogue with persons with disabilities. WHO is committed, as am I personally, to listening to the voices of people with disabilities. As the first speaker said, nothing for us without us. And I fully agree. And I would like to invite the International Disability Alliance to engage in these critical discussions with myself and my colleagues from WHO. WHO is already taking many steps to support countries build a disability-inclusive health sector. For example, as part of our Quality Rights Initiative, a human rights-based approach in mental health services is being introduced in many countries for people with mental health conditions and psychosocial disabilities. Through our WHO Rehabilitation 2030 initiative and our work on assistive technology, rehabilitation and assistive technologies are being included in national packages of care as part of universal health coverage. Excellencies, dear colleagues and friends, more than 1 billion people around the world experience some form of disability. The right to health belongs to everybody, which is why we must work together to recognize the barriers that prevent people with disabilities from accessing the services they need. To commit to creating a disability inclusive health sector and to act to make it a reality. I thank you. Femi, back to you.
Thank you so much, Dr. Tedros. I was on the UNFPA Twitter feed a little while ago. Let me read you this tweet. It's a good one. Did you know persons with disabilities are 3 times more likely to be denied healthcare? The executive director of the UNFPA will be joining this meeting to discuss. That was the tweet. Let's see the reality. Dr. Natalia Kanu joins us to talk about disability inclusion from the UNFPA. Natalia, it's always good to see you, have you in a meeting. You bring fire and passion. Over to you.
Thank you so much, Femi. Your Excellency, Prime Minister Norway, Minister Ageman Manu, Minister Horowitz, the President of the International Disability Alliance, Yanis Varadkar, thank you so much for your remarks. Dr. Tedros, my dear brother colleagues, dear young people, dear partners, I'm really pleased to join you. And I particularly thank the International Disability Alliance, Norway, Ghana, Israel, and the World Health Organization for bringing us together on this important pre-summit occasion. And I'd like to begin with a challenge question. What is disability really? For me, and from the perspective of UNFPA and our partners, disability is actually synonymous with opportunity. There's an opportunity there that has to be leveraged to give someone the advantage to prove that with the right type of assistance, there really are no limits to human potential. As we've heard, disability is common, it is prevalent. Sometimes it's obvious and sometimes it is not really noticeable. Yet, when someone is differently abled, new horizons open up. There's opportunity for discovery, for looking for new solutions, for innovation, and ways of approaching issues that no one's ever thought of before. There's opportunity to break down the barriers and to defy stereotypes. There is opportunity to create a much more accessible world. And as an added plus, that accessible world advances equality for everyone. And nowhere is this more important than in the health sector. We need to come together to find new and creative ways to deliver health services. And I have to add, especially sexual and reproductive health services, which are part of the intimacy of life and the right of someone with a disability, as well as everyone. And that's where the inclusion issue comes very starkly. We must respect the rights and the dignity of everyone, especially women and girls with disabilities. Women with disabilities account for almost 1/5 of women worldwide. Increasingly, they're standing up for their rights, and their demand is we decide. As we heard from the president of the Disability Alliance, nothing about us without us. People with disabilities are working with UNFPA, with governments, with other partners to strengthen disability inclusion. The leadership that we need is there, and they've been participating in the design and implementation of sexual and reproductive health policies and programs, working to dismantle those stereotypes that I mentioned and to break taboos so that everyone can assert their own bodily autonomy, their body right, and have full access to sexual and reproductive health services. And I say again, let's begin by challenging ourselves to change those ingrained attitudes about what disability and sexual health and pleasure look like? A young woman in Ecuador just told us in UNFPA that so many people in her community seem surprised she's disabled, and people are surprised that she has intimate relationships. At a pharmacy, she was asked, "Are these contraceptives really for you?" For women and girls with disabilities, the right to health is not just about being able to obtain health services without judgment or discrimination, which it is about that, but it's also about the right to make their own decisions about their own bodies and their sexuality, completely free from coercion or from violence. And these are the facts that women with disabilities are up to 10 times more likely to experience gender-based violence. Young people with disabilities are nearly 4 times more likely to be subjected to sexual violence, with girls facing the greatest risk. As part of our recently launched UNFPA Disability Inclusion Strategy, we promote the fundamental human rights of persons with disabilities in all areas of their lives. And our flagship disability inclusion program is called We Decide. And it's gone beyond words. It's all about action and deeds, collective action that's led by people with different abilities, and it brings positive change to the health and the well-being of disabled people everywhere. So in the spirit of allyship, let me leave you with this East African proverb. Umoja ni nguvu. In unity, there's strength. And I look forward to the upcoming Global Disability Summit, which will be a time to celebrate, a time to learn and to commit to action. And I hope that we will all re-examine our attitudes towards the diversity of abilities that we all share and help carry forward my message of opportunity, of possibilities that can be achieved through unity of purpose, collaboration, and resolve. And so I hope that we will unite and join with the disabilities communities on this aegis of inclusion. It's an agenda of unity, of purpose, and well in keeping with the Sustainable Development Goals. That's how we're going to make access to sexual and reproductive health and all rights a reality for people with disabilities and a reality for everyone on the planet. Thank you so much.
Thank you. So, if you're following our meeting and you want to share what you've heard on social media, let me give you a few hashtags to use. Hashtag GDS2022. Hashtag disability inclusion, and hashtag health for all. I am going to unpack health for all. What does it really look like in real life? Take a look.
Health for all means that everyone, everywhere, receives the quality, affordable health services they need. But some people are left behind, and the COVID-19 pandemic has made this inequality more extreme. Persons with disabilities are twice as likely to have catastrophic healthcare costs, 3 times as likely to be denied healthcare, and 4 times as likely to be treated inadequately in the healthcare system. Less than half of people in need of rehabilitation services receive them. Only 1 in 10 people has access to assistive technology they need. And for people with mental health conditions and psychosocial disabilities, life expectancy can be reduced by up to 25 years. Worldwide, there are more than 1 billion people with disabilities. Half are over the age of 60. 1 in 10 are children. We must commit to disability inclusion to achieve health for all. Disability inclusion means living up to the principles of universal health coverage, quality, equity, accountability, sustainability. It means we create accessible environments, products, and services, put people at the center of healthcare systems, and act against discrimination. Unless persons with disabilities are included and their voices are heard,
Leave no one behind.
we can never achieve health for all. Now is the time to commit to change and make the health sector inclusive. It is not a matter of choice. It is a matter of health for all.
Commit to disability inclusion. #Health for All. #Commit to Change. Along the bottom of the screen from the left, the Global Disability Summit logo, the WHO logo, the Norwegian Ministry of Foreign Affairs logo, the Ghanaian Ministry logo, and the International Disability Alliance logo. For all photo and video credits, copyright and licensing information, contact disability@who.int.
If we need our health sectors to change so that they really do feature disability inclusion, then it's critical that the voices of people with disabilities are listened to. That's exactly what we're about to do. I'm going to say hello to Ashura, to Olga, to Tom. They're going to do their own magnificent introductions. It is not a TED Talk, guests, okay? Panel, don't take away the whole meeting, because each one of you, I could listen to you for an hour. So Ashura, please introduce yourself to our meeting. Tell everybody who you are and what you do.
She's using sign language. Ashura is talking with sign language. Her interpreter is lacking because of technical issues.
All right, Ashura, thank you for that introduction. We are going to just send you backstage for just a moment because we are not hearing your interpreter, which gives us a little bit of an experience of what it is like to be excluded from a conversation. So we're actually seeing this in action here. Olga, welcome. Please introduce yourself to our international audience and tell them who you are and what you do.
Olga is speaking.
I'm part of the Hearing Voices Network. Can you hear me? I could hear a voice. I don't know if that was.
We can hear you now clearly. Go ahead, Olga.
Okay, I was just thinking about the nothing about us without us, and that's such an important thing. And I feel I'm so grateful to be here today. And my name is Olga Runciman, and I'm here as part of the Hearing Voices Network, which is found in my country, but it's also found in over 30 other countries. So it's pretty spread around, and we work for self-help, to support each other and work within a sort of a community network setting, and talk about that these experiences are very meaningful and are not part of an illness paradigm.
Oh, if you don't know Olga's work and her background, you're about to be very shocked. She's very controversial, but in a fabulous way. Tom, thank you for your patience. Please introduce yourself to our global audience. I have a feeling that they know you because you're pretty much a rock star in your field, but go ahead.
Thank you very much. I'm Tom Shakespeare, and I'm a researcher and have been for 30 years or so, and used to work at WHO and have always been interested in health. So I've got a lifelong disability. I've got dwarfism, technically called skeletal dysplasia. And because it has often secondary complications, I've experienced considerable spinal problems. And I've been hospitalized. I've had rehabilitation for paraplegia in 2008. I've been bedbound in 1997 and 2021 this year. And I've personally been supported by orthopedic surgeon, neurologist, respiratory medicine, physiotherapy, occupational therapy, as well as, of course, by my family doctor, my general practitioner. And I think it's really important to get across that people do need access to general healthcare. All disabled people need that. But many disabled people need specific healthcare related to their primary condition. And so they might require medications, such as for insulin. They might require surgery for spina bifida, which is really about survival, or treatment for clubfoot, that's talipes, or hip replacements if they're older, or cataract surgery if they're older, or physiotherapy or speech and language therapy. So we often have lifelong needs for rehabilitation interventions in order to maximize our functioning. But of course, rehabilitation often doesn't have high priority within health systems. It's not curing, it's enabling you to live better with the condition. And so maybe it's less attractive for funders. Many people with disabilities have a narrower margin of health than persons without disabilities. We're more at risk of secondary conditions. We're more at risk of comorbidities, not least because many disabled people are poorer and more socially disadvantaged. Some require priority for the COVID-19 vaccination because they are, for example, with intellectual disability, with a compromised immune system, greater exposure to the virus. And many older people and persons with disabilities have a much higher death toll, sadly, from COVID-19. And some are still denied the vaccinations they need. Now, I live in the UK. And so all of the medication, the vaccination, everything else is available for free through a socialized health system. And I've had my three booster vaccinations, my flu vaccinations. And of course, you can see I'm a white, middle-class male. So I'm very much able to advocate for my own health needs in the healthcare system. And many people, even in the UK, with intellectual disabilities, may have unmet need or die earlier because they're less able to receive equal treatment. They face discrimination, or they're less able to advocate for themselves. Mm-hmm. And globally, many people, both with my condition and many, many others, don't have access to needed healthcare or rehabilitation. And that violates Article 25 of the Convention on the Rights of Persons with Disabilities, which is about the right to health. And as a result, disabled people can experience more suffering and even premature death. And they may face, as we've heard, barriers of poor access, low awareness, negative attitudes in healthcare settings, or simply not enough healthcare services or expertise to ensure good enough services. And we've already heard that people with disabilities have a 50% higher risk of catastrophic healthcare expenditure, which pushes them into poverty. And so I think, and it's an academic and a thinker about these things, we want equity in healthcare, not equality. On average, people with disabilities may have higher needs for healthcare. So we need the healthcare that we need. We don't just need equal to everybody else.
Tom.
Of course, disability isn't simply a health issue, but healthcare can be the difference between life and death for people with disabilities. I'll stop there. Thank you.
Thanks, Tom. I will come back to you. I do want to share the conversation with your co-panelists. Going back to Ashura, keeping my fingers crossed the connectivity is working so that we can hear your interpreter as well. What I wanted to do in this part of our meeting was to focus on your lived experience from what your disability and then your experience in the health sector. What can you share with us that helps us understand the challenges better, the barriers better? So while Ashura is signing. Unfortunately, we don't have the audio because there's a lack of bandwidth where Ashura is. And we're just very grateful to be able to see you, Ashura, and to have you part of this conversation. But it is frustrating. And even just having you here is really helpful. But we cannot hear the interpreter. So I do apologize about that. I'm going to bring in Olga, and then we do our best to see what we can do. It might help, Ashura, if we... I'll come back to you. I'm going to see if I can sort of brainstorm what to do here. Let me go to Olga. Olga, you have experience as a medical professional and also somebody who has to use the health sector, and you've had a particularly challenging time for doing that, and you're very outspoken about psychiatry. I'm going to get you to start that story, but I think it might shake a few people up. Go ahead.
Okay, well, thank you. Thank you for that. Yes, I used to work as a psychiatric nurse, and then I became a patient of the same system, which I always say is the place that that's where I learned the most. And it was quite an extraordinary experience because I worked as a professional in there, and then suddenly becoming a patient, I lost my voice completely. When I say lost my voice, I lost the respect. Nobody would listen. I was viewed through a lens of madness, and everything I said was interpreted through personal, not my point of view or anything. And so it became a sort of Kafkan world, I'd say. I was exposed, as many people who are labeled as schizophrenic, which is the label I was given, to human rights abuses with forced medication, forced seclusion, all these sort of things. And earlier we were talking about how many women are exposed to dreadfully to sexual abuse and so on. This is something I too have experienced. And the thing is that many people within the system don't realize that when they are force medicating, for example, people who typically have been labeled schizophrenic, and by the way, an awful lot of them have story of trauma in the form of abuse or violence and of sexual violence. It is deemed in the sense of help, and yet it is very reminiscent of being assaulted all over again, and this time you're having to say it's for your own good. So there are many, many aspects of mental health that is still filled with abuse and coercion. People mean well, because it's not as if, I never entered into the system to be an abusive helper or anything. But we also have a culture of treatment. There is no, at least in the West, with medication, mostly medication, and we don't acknowledge the dreadful life stories that people carry with them. So there's so many changes that need to actually be done, and that's one of the things that I'm so actually incredibly grateful that, for example, WHO and Quality Rights is being created, if you like, has been under creation for a long time. And I just want to actually take this opportunity as well to say thank you to Dr. Tedros, because, to allow this initiative, this amazing initiative, because when such a huge organization as WHO gets behind human rights within the disability movement, and especially the psychosocial disability, that will promote change. I am absolutely convinced of that. So I am very outspoken about psychiatry. One of the reasons we created the Hearing Voices Network is to acknowledge these dreadful life stories, to create a community, and to help create meaning and understanding, which is what many of the symptoms are representing, is these stories that often have no words, that have become very difficult to talk about. forbidden. Many things can be absolutely forbidden. You're not allowed to talk about it. The distortion of reality typically that occurs when you're a child. And that creates difficulties also being able to interpret reality sometimes. So this is something we try to help in the community. I've also experienced, for example, when I broke my arm, just sort of a story, I broke my arm and I had to have it put in a plaster. And a week later, I had to have it checked to make sure that it was setting up properly. And I went to the hospital and I asked where this office for the doctor was. And I'd been told it was next to the emergency, but they insisted on pointing me in a different direction. So in the end, I walked to that direction and it was to mental health. And these are little small stories, but they show just how much we are viewed through the lens of madness versus not, actually sometimes having something that is physically also wrong. And also this extremely high, the fact that we, on average, live about 25 years shorter than...
Oh, that right there. That right there is the motivation for getting rid of the barriers. All right, if you want to see a disappointed face, just look at Ashura right now.
I am so sorry.
Ashura, I do apologize. Technical difficulties, 1. Our pre-summit meeting, 0. I'm going to see if I can send you away, find a little bit of time left in our program to see if we can get you back, if we can fix the microphone for your interpreter. We see you signing, but unfortunately we're not unable to hear your interpreter. Yes! Right at the end. Oh my goodness. All right. So, Ashura, here's what I want you to do for us, because we're wrapping up here. Can you tell us, we've heard of these various different challenges with the health sector not listening to the voices of people with disabilities. So disability inclusion is embedded in the health sector. What do you suggest is done about that? Go ahead.
Thank you so much for the opportunity once again. Sorry for the technical hitch. I would like to thank the Norway government, the government of Ghana, IDA, and all our partners, especially now with the COVID. The issue of health becomes more difficult. I would say even 10 times, especially for women with disability. Imagine I'm a woman, I'm youth, and I'm deaf. That means I face a triple tragedy, which and I would say the most challenging fact is when you get to a health center, the communication barrier. Now the case comes when the facilities in the health centers are inaccessible. I'm happy that Dr. Teddy is here from WHO, who should make sure that whenever the procurement process is done, it should be disability friendly. For example, most especially when you talk about maternity, they don't have the beds that are suitable and accessible to women with disability. Most women with disability give birth on the floor. With Article 25 of UNCRPD, all persons have a right to access standard healthcare. But we don't access that, and most of healthcare personnel are not trained in sign language. So communication becomes the bigger barrier. If we remember what Mandela said, communication is everything. For us to succeed and become better in Africa, we cannot achieve all our vision when there's a communication barrier. I think the world should come together and make sure that all persons have access to standard health care. Yes, I appreciate there's some efforts that have been made by different governments, but especially I'll give in my country, I'll give an example in my country. We have a health insurance cover, but all people can access health. But the sad thing is, people or those who have severe disability, especially when you talk about autism, the medication is so expensive, and the national insurance does not cover that. So it burdens the parents or guardians of those with children who have autism. So the UN must make sure that all sectors implement standard healthcare for all, access to information. The procurement process should be standardized so that we have universal standard that is accessible to the health facilities.
Sure. Thank you so much. It was so worth deciding to keep going until we actually could hear the interpreter. We really appreciate you. Thank you, Ashura, Tom, and Olga for being part of the meeting today. Ashura mentioned governments, and this is where we're going to next, to talk about national investment in disability inclusion. Thank you very much, panel. Please mute yourself as we continue with our programme. So we go next to the United Kingdom, where Vicky Ford is an MP, and she joins us from the Foreign, Commonwealth and Development Office. Welcome, Vicky.
Honourable guests, ministers, colleagues, friends, thank you for your commitment to highlighting the importance of disability inclusion to achieve health for all. Around the world, COVID-19 has put huge pressure on health systems, and this has particularly impacted on people with disabilities. Yet the UN Convention on the Rights of Persons with Disabilities states that they have the right to the highest attainable standard of health without discrimination. Everyone needs access to good quality health services throughout their lives, including people with disabilities, who frequently face multiple barriers to accessing quality health services, often face higher healthcare needs, and often have less health coverage. Their special needs are often unmet, including rehabilitation and assistive technology services. Compared to people without disabilities, they often have reduced access to general care, including mental health services, and realising their sexual and reproductive health and rights. This can be compounded by barriers to accessing adequate nutrition, clean water, and good sanitation and hygiene. The pandemic threatens to reverse the progress we have made over recent years through tragic loss of life and through the secondary impacts of COVID-19, which are disproportionately affecting people with disabilities. We must do all we can collectively to tackle this by ensuring health systems are robust, inclusive, accessible, non-discriminatory, and of good quality. And I am proud to represent the UK today as a global leader on this agenda. As the Minister responsible for disability inclusion in the Foreign, Commonwealth and Development Office, I'm proud of the work we've continued to take forward since co-hosting the first Global Disability Summit in 2018. And we look forward to supporting the next summit, which will take place next month. I want to take the opportunity today to outline how we are mainstreaming disability inclusion into our global health portfolio. We'll shortly be launching a disability inclusion strategy, which for the first time will feature a pillar on inclusive health. We will emphasise the importance of the voices of people with disabilities and the urgent need for more data and evidence to understand what works and what more we need to do to make health systems more disability inclusive. The UK government will also harness our diplomatic and development know-how to strengthen the alliances needed to improve health globally by working together with our bilateral and multilateral partners. To underpin this strategy, last year we also introduced 2 new UK government papers. The first set out a clear pathway towards stronger health systems, taking a whole system approach and with disability inclusion embedded in its development, improving coverage through the removal of barriers to healthcare and committing to leave no one behind. The second was a roadmap for cutting preventable maternal, newborn and child deaths, with a pillar specifically focused on empowerment and equality, which includes disability as a focus within this work. Achieving our goals will require all of us to work together internationally. So thank you for your collective leadership today. I believe there was a clear vision and a united approach, working with the health sector to make sure the inclusion of people with disabilities is a mainstream aspect of this work. We can make real progress and help to ensure that people with disabilities are no longer left behind when it comes to fulfilling their right to good health and well-being. Thank you.
Thank you. We move from the UK virtually to Israel, where Nitzan Horowitz is the Minister of Health. Minister, it's so good to have you here in this conversation. I think a lot of our meeting is thinking, what can governments do? What are they doing to make sure their health sectors include disability inclusion? If I ask you that and think about Israel, what would you share?
Well, thank you, Femi. And first of all, I would like to begin by thanking the World Health Organization, the International Disability Alliance, and the governments of Norway and Ghana for convening this important event. And I'm very happy to be here with you directly from Tel Aviv. Well, access to quality healthcare is key to promote public health and achieve the 2030 Agenda for Sustainable Development of leaving no one behind. For instance, the COVID pandemic showed us all how interconnected our world is and how important and crucial adequate access to healthcare is, of course, to people with disabilities. During the COVID crisis here in Israel, for example, we tried to inform and educate both the public and the healthcare providers in the most accessible manner possible. We put out information in simple language and in sign language and instructed, I'll give you an example, we instructed all general hospitals to hold a transparent mask so that people with hearing difficulties would be able to understand and to communicate with their physicians. We also have the legal obligation here in Israel to ensure that our medical services are accessible on all levels, including accessible service and access to diagnostic technologies, from the very simple appointment with the doctor to an MRI test or everything else. We are working now specifically on a set of rules that establish the specific criteria for accessible healthcare services. Now, using the model of nothing about us without us, we collaborate with the professionals and organizations to determine together what is required in order to be accessible. Now, you asked what governments can do. Well, first of all, they can admit that they don't have all the answers, and they can integrate, and then they can discuss NGOs and all sorts of organizations to have the answers from the ground. So organizations like Access Israel here in Israel, for instance, help us to ensure that our criteria meet the public needs and disability and abilities.
Thank you so much, Minister Horowitz. We are staying in Israel because we have one of your great musical artists joining us. I'm sure you've seen the Shalva Band. Sure. You must have. Yes, you know about them. How would you describe them, Minister?
Well, you know, the word Shalva in Hebrew means tranquility, peace, tranquility, calm. And this is a fantastic group of young people, extremely talented, with some disabilities that sort of overcame this difficulty, and they perform and they provide us with this enormous gift of their talent. And they're great. I love them, and they're performing all over the world. And I'm very happy that we will be able to see them here now. And I really would like to thank them and tell them in Hebrew, Toda Rabba, and thank you very much. And we should all keep the spirit of Shalva Band. And, they're my example of how you can overcome difficulties and enrich us all.
So, Minister Horowitz, if you ever give up on politics, you could be an excellent disc jockey. I love your introduction for the Shalva Band. Let's take a musical break. Performing for us today, thank you, Minister. Appreciate you very much. Performing for us today, the Shalva Band.
The Shalva Band on stage, one of the singers, Dina, reading Brailles.
We are all humans. We have our differences. And that's what makes our lives interesting. For too often, persons with disability face barriers and stigma and don't receive the health services they need.
I think of what the world could be if we broke down these barriers. A word of respect and acceptance. It's our responsibility to ensure that our voices are being heard and that no one is left behind.
Close my eyes and I can see a world that's waiting up for me that I call my own. Through the dark, through the door, through where no one's been before, but it feels like home. They can say it all sounds crazy. They can say I've lost my mind. I don't care if they call me crazy. We can live in a world that we decide. 'Cause every night I lie in bed, the brightest colors fill my head, and million dreams are keeping me awake. I think of what the world could be, the vision of the one I see, and million dreams is all it's gonna take. A million dreams for the world we're gonna make. However big, however small, let me be part of it all. Share your dreams with me. We may be right, we may be wrong. I wanna bring you along to the world I see, to the world we close our eyes to see. We close our eyes to see.
logo, Israel and the WHO. Hashtag health for all.
That was the Shower Band performing A Million Dreams. It's really nice to have two of the band with us today. Sarah, Dina, welcome. Please introduce yourself to the summit delegates. Go ahead.
Hello.
Hi.
We are Sarah and Dina from the Shalva Band. Sarah Samuels, I'm the guitarist and backup singer, and
I'm Dina. Hi.
Dina's our singer.
Nice to have both of you here. I wanted to ask you about the Shalva Band and who's in it and your mission. Now, often with bands, they just want to play music, they play whatever they want to play, and they have a genre that they're aiming to kind of put out there to their audience. The Shalva Band comes with a mission folded into the reason the band is there. Can you tell us about that, Dina and Sarah?
דינה, מה המשימה של הלהקה?
מה המשימה של הלהקה? המשימה של הלהקה זה בעצם עם כל הקושי, וזה באמת לא משנה. אנחנו בזכות הכישרון שיש לנו, חשוב לנו לגדול במוזיקה, וכמובן לתת תקווה לכל כך הרבה נשים.
Our mission as a band is, of course, to grow as musicians, no matter what difficulty, and to inspire as much hope possible for everyone that sees us.
I am curious about the reaction when people, first of all, see you on stage. So there's that moment, and then a moment when they hear the music, because once they hear the music, any preconceptions that they may have had will, as far as I'm concerned, disappear. Can you tell us about that moment before they know about you, and in the moment when they hear and they see you perform?
Yeah, that is true.
מעניין, איך היא חושבת? תשאלי אותה.
People, Dina's asking what you think about it. But it's true.
What did I think about it? This is great music. I've been listening to various different concerts of yours through the week, jamming in the bathroom. I love it. So the music itself has the message. Yeah, but go ahead. What are other people's reactions?
People, actually, when we were on reality TV in Israel's Got Talent, it was very noticeable, that aspect of the judges especially suddenly like, okay, we get on stage and they're not sure what to expect. Are they going to be cute? Are they going to be okay? And then they're like, whoa, like, these are real good musicians. And we're, of course, humbled and flattered. But yeah, people, like you said, forget right away about any prejudgment or misconception and really focus on the artists that we are. And that's, like Dina said earlier, our main mission in a way. Besides
Dina, that has got to be the story for everybody who has a disability, who wants to be truly included. It's just listen to us, pay attention to us, and you will see what our talent, what our skills are. But when you're singing, you have the most gorgeous voice. Do you think about that? Or are you just thinking, what is the best performance that I can do? Do you feel that responsibility? Is there one?
את מרגישה אחריות כשאת שרה, או שאת פשוט רוצה לשיר יפה, או שאת מרגישה שליחה של משהו, אחראית משהו? על מסר.
וואו, אני מרגישה...
זה גם מחמיאה לך על הקול שלך.
אני מרגישה על הכל. אני מרגישה שיש לי אחריות מאוד מאוד גדולה. אבל קודם כל, אני עושה את משהו שאני הכי אוהבת, כי זה הכישרון שיש לי. מצד שאני גם מעבירה כל כך הרבה מסר לאנשים, גם זה בארץ ישראל שהיא מדינה כל כך קטנה, ולעומת זאת, ואנחנו להקת שלווה, זכינו לטוס לכל כך הרבה מקומות בעולם, ואנחנו באמת כאילו מעבירים את המסר.
Dina says that on one hand she feels great responsibility to give over a lot of messages of hope and inspiring and, you know, getting over everything that could stand in your way and just dream. On the other hand, she does enjoy her job as an artist and performer, and it is what she does best, obviously, and she enjoys that.
I'm wondering about the band dynamic. It's a pretty big band, lots of personalities in there, lots of interesting characters. We don't have the guys here, so you can dish. Go ahead.
תגידי שכל מי שנמצא בלהקה, זה כל אחד, זה עולם ומלואו.
Dina says that each and every band member is an entire universe unto itself. So true. Our dynamic, we're like a family. We're like a very close family.
So that brings me to, what is the message? You brought some music to us here at the Pre-Summit. What is the message that you would like to leave us with before we move on with the rest of our program?
מה המסר העיקרי שלנו? Our message, always believe in yourselves. Know who you are and choose the best qualities within you to bring out to the world. Know that you are worthy. And if we could do what we do and love what we do, then no reason anybody else can't pursue any dream, any thought. And there's nothing that could be ever impossible for you. And we also believe that health is a very important right as human rights, and many other rights are included in health. And yeah.
Zara, Dina, and the Shower Band providing a mic drop moment for this meeting. So, who could possibly follow that and not be intimidated? Robert Mardini. Ciao. Come stai? Hello.
Hi, good to see you. Penny.
Nice to see you. Robert, will you introduce yourself to our meeting? Tell everybody your important job title, please.
Well, Happy New Year, everyone. And thank you, Femi. Thank you, the governments of Ghana and Norway and the International Disability Alliance for having the ICRC in this important event. I'm Robert Mardini. I'm the Director General of the International Committee of the Red Cross.
Robert, I want you to talk to us about the importance of an inclusive health sector when it comes to emergency health.
Thank you, Femi. Let me start with a simple observation. The impact of large-scale health emergencies on individuals and communities is particularly severe when other humanitarian crises are already playing out, including, for instance, in places affected by armed conflict and violence. And this makes it all the more important for responses to be rapid and flexible. A health sector that is inclusive of persons with disabilities is better suited to responding to health emergencies, since many of the policies, many of the services and practices can effectively be used to absorb additional demand. For example, critical health messages can reach all members of affected communities, including persons who, for instance, cannot hear or see well. Health facilities and transport services that are already adapted for easy access by people with impaired mobility, for instance, facilitate better management of seriously wounded patients. Organizations working with persons with disabilities can effectively contribute to local production of PPE, for instance, as is the case in Yemen during the COVID-19 pandemic. Moreover, if a health system is not inclusive and accessible to persons with disabilities before a crisis, it is unlikely to be able to meet the needs of persons with disabilities who are already in a high level of vulnerability and often isolated, stigmatized, and dependent on others. So coming up with a firefighting plan in the middle of a fire is not a good thing. We need to do as much as possible to make health systems inclusive of persons with disabilities and therefore more resilient prior to having to deal with the health emergencies. And this is applicable to all countries and contexts, including, of course, those affected by armed conflict where the ICRC operates.
Robert, I like the way you describe coming up with a firefighting plan in the middle of a fire. That speaks wonderfully to what we're talking about here. So that means your plan has to be in place way beforehand. Are you seeing that in the emergency health sector, emergency sector, where people are already thinking about people with disabilities? How are they in that plan? What will we do? Are you seeing that?
Well, not all the time, to be quite frank, Femi. And as we've heard it many times this afternoon, the key principle in the Convention on the Rights of Persons with Disabilities, nothing about us without us, And if you want to be relevant, if you want to be effective and efficient in implementing an inclusive emergency response, and if you want to have health systems that are most and more resilient, we need to have people who understand the situation of persons with disabilities, having them sitting around the table, around the decision-making table. So for us, involving people with lived experiences in the planning and implementation phases will allow us to break the vicious circle where disability leads to reduced access to health services, poor health conditions and outcome, and then additional disability as a result. So importantly, it will also promote the implementation of early rehabilitation components, which are key to prevent long-term complications. The ICRT has been working for more than 4 decades, since 1979, in the field of physical rehabilitation in some of the most challenging, difficult humanitarian settings around the globe. And while we do have an inclusive workforce approach in our physical rehabilitation projects, for instance, in Afghanistan, where the vast majority of our staff are people with disabilities who were able to overcome their physical impairment and are able to work and deliver a service to society. We have a disability and inclusion advisor, for instance, in 25 of our projects. We know that much more needs to be done. For example, in many of the countries where we work, there are few development opportunities in the health sector for persons with disabilities, and this needs absolutely to change.
Robert Mardini, thank you for sharing your thoughts with us about the inclusivity of disability when we're looking at emergency situations. Really appreciate you.
Thank you, Femi.
You're so welcome. Moving on with our meeting and our program, we're going to be looking at advocacy and the benefits of disability inclusion. I know that we know, but how do we get that message out globally? I have 3 guests who are going to be able to do that for you. I'm going to say hello to Christopher, hello to Jane, and also to Dominic, and they are going to tell you their perfect job titles and what brings them to the table by way of introduction. Christopher, you start your introduction first. Go ahead.
Thank you, Femi. Thank you so much for having me. My name is Christopher Agbaga. I am from Ghana. I am a member of the Global Advisory Committee on NCDs and also an advocate and a peer trainer. And I also work with the Ghana Federation of Disability Organizations. I work specifically on COVID-19 and accessibility. I've been living with a disability and an NCD for the past 14 years. So this to me is so wonderful. I take this honor in high esteem, and thank you so much, Femi.
Oh, you're so glad to have you here. Hello, Jane. Please introduce yourself. What do we need to know about you?
Yeah, hi, Femi. My name's Jane Barrett, and I'm the Secretary General of the International Federation on Ageing. And it's curious being invited to such an important meeting because the organisation represents about 85 million older people. But, you know, I've got this unique nexus because I was one of those young carers for a brother with a congenital defect from birth and a disability all of his life. So I come to this conversation with a unique understanding of disability and the words function, inclusion, participation, and in organisations whose vision is a world of healthy older people whose rights are both protected and respected. Now, we could take the word older people out and just say a world of healthy people whose rights are protected and respected. So I bring that kind of tone and call for collaboration and stakeholder engagements across sectors and across disciplines. So good to be with you, Femi.
So good to have you. One more panellist for you to meet, and that's Dom. Hello, Dom.
Hi, Femi. Hi, Chris and Jane. Firstly, let me just thank all of the previous speakers and panellists for provoking some thought and sharing experiences. So I'm Dom Haslam. I'm chair of the International Disability and Development Consortium, which is a global network of civil society organisations and OPDs working in disability inclusive development. So I'm here on behalf of many of those organizations. I'd also just briefly at the start like to thank WHO, Norway, Ghana, and the International Disability Alliance for bringing us together, because I guess I'm finding it a bit strange that I've been working in the field of disability inclusive health for maybe 10 years, but this is the first time I've met either Chris or Jane, which feels a bit odd. And given the overlap between disability inclusion, older people's inclusion, and non-communicable diseases, I think that's a really big oversight. So I hope the three of us can make a commitment that this panel's the beginning of a conversation and not the end. Thanks, Femi.
Dom, I'm so glad you said that, because I'm now going to make you work overtime because of that. Because I want to look at how you join forces with Chris, NCDs and disability awareness, and then how you join forces with Jane, looking at seniors and disability awareness and that advocacy, how that happens. Chris, how is that going to happen?
Thank you once again, Femi. And I think that is a very, very important point made by Dom. I first of all want to start by saying that, Femi, I am not an exception. In my introduction, I said that I have lived with an NCD and a disability for the past 14 years. So, and because of that, I use a wheelchair now, which wasn't so back then. The barriers I have faced, just to mention a few, are accessibility, affordability, and of course, the negative attitudes I have faced among some health professionals. So, and one thing I also want us to also understand is that when it comes to NCDs, people with NCDs go on to develop some levels of disability. And a lot of people with disability go on to develop some levels of NCDs, not forgetting mental health. It's one of the very important things we need to also highlight. So, Femi, I understand what it means to be a person living in these two worlds, if I should say. And as someone speaking not for myself, but for the communities that I represent, there are commonalities and a certain sense of a shared purpose with the disability community and the NCD community, because it highlights the crossover and the cross-cutting nature of our communities. Now, Femi, unfortunately, COVID has really troubled us. It has actually leveled up the issues that we have faced. In Ghana, I remember a lot of the interventions that have been rolled out. One of the things I'll say to you is, if you are able to access these interventions, well, good for you. But if you can't, well, good luck, because most of these have not been accessible. But there is good news. The good news is that CSOs are working. Just as you heard from Dom, just as you heard from the other speakers, the CSOs are working and they are ready to partner with the government. They are ready to share with the government. I have worked with the Ghana Federation of Disability Organizations. We have met with the Ghana Health Service to find ways of ensuring that the communication that goes out on COVID-19 is accessible to persons with disabilities. The Ghana NCD Alliance has mobilized the NCD community so much and presented their case to the government. The Global NCD Alliance has been working. So, Femi, this is what I'm saying. Formal mechanisms of participation in the health system. Right. This is what we are calling for. And universal health coverage is very, very important. And Femi, I just want to say this before I end. Universal health coverage is so important because, let me put myself here. I had my first symptoms in 2007. I got my diagnosis in 2016. That was 9 years. Femi, if I had an affordable health system, it wouldn't have taken me that long. So if this is my plight, imagine, just think about what others have been going through.
Chris, do you know what's coming up at the end of our program? The Minister of Health from Ghana. I know he's leaning into this conversation right now. Let me share it with Jane, because we're talking about disability advocacy and then also the work that you do with seniors. There should be a very natural synergy between those two areas. Jane, tell us more.
Look, Femi, we've also got to just stop talking about older people as seniors. Actually, that's an ageist term.
What would be a more appropriate term?
Older adults and older people.
Okay.
Because we need to do that because, we're not a homogeneous society. So my first ask, and Dom, you've said it beautifully, this is the first time and it won't be the last time that we're talking together. So civil society actually has to look at ourselves at the same time as we look to government to advocate and to influence policy. Because, for a long time, we've worked in silos also. But what we want is how to create an environment that enables older people, enables people with disabilities to do what they have reason to value. Because by creating that enabling environment, in fact, we're addressing prevention, as Christopher said, access. And we're also dealing with some of the same inequities. COVID has done nothing more than brutally exposed what everybody on this call today has known about all of our lives and all of our careers. And so coming together, civil society, truly in partnerships towards a common agenda is a powerful message to ourselves, our constituents, and also government.
Dom, bring us home. What is missing in this disability inclusion advocacy that we're not doing right now?
Yeah, thanks, Femi. So, just building really on what Chris and Jane have already said, I think, for me, when people talk about advocacy, lots of people start switching off because it's about articles, it's about conventions, it's about sustainable development goals and indicators and targets and so on. And it's sometimes not rooted in reality. And I think one of the key points here, so we're here to talk about the Global Disability Summit. Governments, multilaterals, others will come together and they'll make commitments, including commitments to inclusive health. And that is important. But we need to remember that those commitments have already been made. They've been made under CRPD Article 25. They've been made under Sustainable Development Goal 3. So what we need is not just commitments to talk and to put things in policy, but commitments to act and to effect change, because that's where as CSOs, we can focus our advocacy, but also we can continue to demonstrate how it can be done in every context, because we know it's possible. So the experiences of IDDC's members, working with the International Disability Alliance, working with OPDs around the world, including the Ghana Federation, Chris, I know, and with Ministry of Health, has demonstrated that. It's shown that change isn't only possible, it's happening, but it needs to happen faster because of that basis of the advocacy, the right of all persons with disabilities and older people to be supported to achieve the highest attainable standard of health. Mm-hmm. So for me, we can talk about advocacy, but what we really need to be doing is showing how that change can happen and then making it clear to governments that it is their responsibility and that they have already signed up to these. So more commitments is great, but let's see some action.
Mm. Thank you, Dom. Thank you, Jane. And thank you, Chris. Appreciate you. We move on. How much money would this cost to really break down the barriers so that disability inclusion was really rooted in the health sectors around the world? Juan Pablo Uribe, hello. Good to see you.
Femi, hello. Very
Hi.
happy to be here.
You have such an impressively long title. I'm going to get you to do it. Go ahead.
No. I'm the Global Director for Health, Nutrition, and Population in the World Bank, and I'm also the Director of the Global Financing Facility that works for the health of women, adolescents, and children worldwide.
Juan Pablo, often the most persuasive argument is for governments, for policymakers, when we're asking for inclusion, is this will save you money in the long run. Can you talk to us about what investing in disability inclusion in the health sector, how that will benefit everybody?
Femi, look, at first, congrats to everybody who's behind the scenes making this incredible effort on the summit. And also just to say that to the Chalva band, that song was just impressive. Look, if there's one single public health policy lesson coming out of COVID, it should be that we cannot achieve effectiveness without inclusion. And it's not only in COVID, it's in everything, in public health policy and in human development and in progressing in human capital. In other words, Femi, if inequity prevails, there's no room for improvement. And for all these returns and all the efforts that communities and societies do in investing. So the numbers are shocking. 15% of the population with disability, numbers increasing, by the way, most of them in low-income settings. We need to include in all the public policies all the relevant aspects for the development of everybody. I would say it like that, Femi. Over to you.
Thank you. If you had one sentence, one final message for this pre-summit meeting, looking ahead to the Global Disability Summit, what would you want our meeting attendees to remember, Juan Pablo?
That this inclusion has to start from the beginning at all moments, and that it really needs to address what matters to us, what matters to all. Those are the aspects that, if included from the beginning in the design and in the discussion and the implementation of public policy, even of healthcare delivery design, will really come back as cost-effective investments for me. I would say what matters to all.
Thank you. Well said. Juan Pablo Uribe, thank you for joining our meeting today. Now, if you were at the very beginning of our session, you would have heard me saying that one of our contributors is 1 year old. And how can a 1-year-old help us with our meeting? Well, she does it beautifully. I want you to meet Valerie. She lives in Peru, and this is her story.
A film with Linda Rosbell and their baby girl Valerie. I ask her, who's my princess? She knows she's not just a princess. Okay, who's my queen? Who's my future lawyer? Then she claps her hands. Text: Valerie is 1 year old and has Down syndrome. Iquitos, Peru. I didn't plan to have a child with different abilities. Every day I learn something new. My most touching moments with my daughter are when she reaches out to me like she's saying, "Daddy, come here, I'm waiting for you." It's not easy. There are always people who stare, people who have opinions. I accept that, and I'll stand up for my daughter as long as I live. When she was born, I looked at her. I just cried and said, "Why?" In my ignorance, I rejected my daughter. And the truth is, I regretted it and I begged her to forgive me. I think she can achieve something in life as long as she receives stimulation. It's the same as any child. If the parents doesn't stimulate them, they won't get anywhere. Text: Valerie attends a UNICEF-supported center for young children with disabilities. She has learned a lot at the center. When we got here, she couldn't sit. Now she can sit. And because I stimulate her there, she started walking. She's a good girl, very alert. Text: the center promotes the role of parents in early learning. What we learn at the center, we do the same here. In the future, I imagine her having a partner and a good career too. She'll be the first lawyer with Down syndrome and fight for the rights of all children with disabilities. As parents, we want her to have a full life ahead of her. Text: H&M Foundation supports UNICEF.
Abubakar Campo is the Director of Health for UNICEF. Abu, so good to have you here in the summit. The idea that we're even talking about disability being included in the health sector says to me that there's something wrong with the health sectors and how they're handling disability. Am I making a leap, or are you seeing that in your work?
Thank you, Femi, for having me. And I think disability is a very important discussion which we should be having. I think for UNICEF, our credo in UNICEF is that for every single child. And if you want to bring down all the health indicators to acceptable level, we need to include everyone, not just children without disabilities, but also children with disabilities. When a disaster strikes or when economic hardship is in the communities, the population sections, which is probably the most affected from it, are women and children. But even those who are more affected from those disasters or risks or concerns are actually children with disabilities, because they're usually left out. For example, I mean, when we are doing our programs in public health for child health, whether it's immunization, we are doing this for the general populations. But, doing immunization, just as an example, even for disabled children, should be easy, but it needs to be taken into account, the disability effect, for bringing those children to the facilities, giving them access so that they can basically be there. When we do health educations, for example, we cannot just hand out, the same materials to our children which are visibly, which has vision impairment, giving them a book will not necessarily help. We need to be much more creative, and giving tools to parents so that they can explain to their children or basically cater for their children in a better way. So addressing disability issues is not just the disability in itself, but how do we are preventing, the well-being, or health or good health, or how do we fostering the well-being of those children.
Abu, I like that how. You're asking how a couple of times here, and I'm going to pick up on that how. Mm-hmm. Because if you are a health leader, you're working in the public sector, and you're working on public sector interventions, how do you make sure that you're being inclusive, not exclusive?
Yes, I think it means that you need to cater for every single child. When you do, for example, let me go back to another very practical example. When you do vaccination campaigns, which basically means that you will be vaccinating a lot of children in specific areas, you need to make sure that access, to these vaccination points is granted to all children. So if you have disabled children who are sitting in a wheelchair and your vaccination points is on the 3rd floor where there are no elevator, but that's an issue. You're not taking into account, disabilities. How do you bring those children to the 3rd floor? And these are the kind of things which needs to be taken into account to really make sure that you're inclusive in your planning, in your preparations, and in your actually carrying out, the activity which you would like to do. When we do health information, for example, let's do early child learning activities. Some of these tools which we're using needs to be adapted to children with disabilities. Children which have, hearing impairment, will not be utilizing the same tools as those who don't have a hearing impairment, and which might be a small part of the populations, but they still need to be included, because otherwise we are not inclusive in whatever we are doing. I think we need to move away from the low-hanging fruits, because low-hanging fruits give generalities, and working for disabilities is going beyond the low-hanging fruits.
Yeah. I'm just thinking about what the main challenges are to prevent more inclusivity from happening when it concerns children, people with disabilities, children in the context of UNICEF. Is it resources? Is that always the biggest challenge?
I don't think, for me, it's always just resources. I think when we're looking, for example, at the attitude of health workers, for example, not everyone is comfortable, of catering for a disabled child, because it's much more difficult. Sometimes there are some very difficult disabilities, where people are very uncomfortable with. So it's not so much a matter it is a matter in terms of funding. This is part of it, but not just always. Sometimes it's just also attitude of health workers towards children with disabilities. You can't just brush them away. If it takes 5 minutes for a child without disabilities, it will take maybe 15 minutes, for the same activity for a child with disabilities. But what health workers should be doing is taking this particular time so that it is inclusive. So it's not just funding, there's also attitude. There's also really making a purposeful, push of including every single child and not left anyone behind.
So, where are we with technology and innovation? We haven't talked about that yet in our conversation, but we are about to do that right now. Microsoft's Chief Accessibility Officer is Jenny Lay-Fleury. Jenny, it's so good to have you part of our conversation. For me, it's a no-brainer. Technology, innovation, people with disabilities, of course it's going to be inclusive. You have to. It makes sense. Goes together. Jenny, what's been your experience?
And thank you so much. And it's been fascinating listening to the conversation. And good morning, good afternoon from Seattle on the west coast of the States. Technology is a crucial component of this. Technology has the power to empower, to include people. It also has the power to exclude. And when you think about what we've heard this morning, which is this growing demographic of disability, we've heard that COVID impacts so much disproportionately of the disabled community. And then you think about the importance of technology, particularly in this now virtual world that we're living in. It's never been more important than it is right now.
Can you tell us about some of the work you've been doing at Microsoft that will encourage other businesses to do the same thing?
So our work here is very much charged by the voice of disability. I've had the honor and privilege of being at Microsoft now for 17 years, originally in London and now over here in the States. I'm deaf myself, although my voice you would never know, but I am reliant on interpreters and accommodation services myself, and I'm one of thousands here at Microsoft, and let alone the community that really informs us on a daily basis. And I think the health and the importance of health has been a crucial component for Microsoft in thinking through what we do going forward. Last year, we announced that we're going to be upping our ambition when it comes to accessibility. Yeah, we've been doing this gig for a while, but we're upping it to help tackle that now profound and growing disability divide. So what does that mean? That means, one, we got to work on training, awareness, and education. I think that's one theme that we've heard all the way through this. People need to know how to work with people with disabilities. And personally, as a nerd, I want people to know about all the technology, all the features that is at their fingertips. I want to also make sure that people know how to get support when they need it. We have a dedicated disability answer desk, we call it DAD, that takes around 14,000 calls a month from disabled customers. So training and awareness, we want to get more knowledge out there on accessibility because it's right there. But then we've got to up the bar. We've got to make technology easier to find, easier to use, to power people when they need it the most, to be independent in their use and their conversations. As a deaf person going into medical environments, it's terrifying because I'm worried with masks. I'm worried that doctors are not going to believe me as capable. I'm worried that I'm not going to be able to communicate or understand what people are saying. It's basics, but technology can be the equalizer here if we do it right.
One last thing I want to ask you for, Jenny, is what's the final message you want to leave us with as we're getting ready for the big Global Disability Summit in February? What would be the last thing? What would be your mic drop moment?
Oh my gosh, I'm not a mic drop, but I will say that it's so important for us to be working together right now. If we've learned anything in these couple of years, it's that technology can be a differentiator, but it's important that it's designed with, for, and through the lens of disability. So gather those insights, share those insights. Trust me, I'm one technology of many that is listening and wanting that feedback so that we can help unlock and we can help make sure that healthcare, that communication, that everything that is a human right can be powered through the lens of technology.
Jenny, thank you so much for joining us. We really appreciate you being part of this meeting. We move on to the penultimate speaker for this program, the very patient Vladimir Chuk. Vladimir, welcome. So nice to see you. Will you tell everybody what it is that you do?
Thank you very much, Femi, for having us here today. My name is Vladimir Chuk. I'm Executive Director, International Disability Alliance. So I had very dynamic organization that is representing organizations of persons with disabilities through 40 networks that we bring together that in turn have membership across 182 countries of the world, bringing more than 1,000 national organizations of persons with disabilities.
Vladimir, I am projecting forward to the Global Disability Summit, which is happening in February, and the commitments that come out of that summit. How do you think that may well change the way the health sector views disability inclusion? I'm asking you to do a little bit of prognostication here.
I hope that really indeed GDS, Global Disability Summit, will be able to continue on the path of good news, successes. Many developments have been made prior to this pandemic on the rights of persons with disabilities. We were even in a position to a little bit celebrate, if you like. But with the COVID-19, we learned very quickly that the job is not done, that we have to redouble our work, that we have to go back to like square one sometimes, and we need to do much more, and we need to really work with everybody that can support the rights of persons with disabilities. When it comes to health, interestingly, in the first Global Disability Summit, health was not prioritized as one of the topics. Clearly, pandemic changed that. So now with the summit number 2 that will be happening on February 16 and 17, in just 1 month, one short month, we definitely prioritized health. Interestingly, International Disability Alliance ran a set of consultations. It was face-to-face consultations that were safely organized, and also many virtual consultations. As a result, persons with disabilities have spoken and said that health is important. So we are hoping that many of the people listening to this session, and many that are not, will be making very important commitments. Commitments are simply tasks that different organizations, corporations, UN agencies, governments will set themselves to do over the next period of time. And then we from Global Disability Summit Secretariat will be following on those commitments later on, and simply asking them, how are you doing with these commitments, and then celebrate successes. So this is a concrete way how we can change something. So we call it commit to change, and you can follow up. You can follow this hashtag on Twitter.
Mm-hmm. I really appreciate the follow-up, because often in forums like this, we spend a lot of time talking. And as Dom said, we don't want to do the talking, we actually want to do the action. So when you say, how are you doing on your commitment, how much pressure do you put on the people who made that commitment?
Right. The idea is not to put so much pressure, as the idea of the summit is to really motivate people, to motivate stakeholders to do more. We have Convention on the Rights of Persons with Disabilities. This is official legal responsibility of governments to do more on the rights of persons with disabilities. This is just a supporting feature, let's call it. It is a motivational force. Mm-hmm. So we want to motivate people to do more. So it's not pressure, except if you consider peer pressure as a pressure, which sometimes works very well.
It does. Thank you so much, Vladimir Chuk, for being part of our pre-meeting for the Global Disability Summit, which happens in February. Appreciate you. Thank you.
Thank you.
We wrap up our meeting with co-host Ghana, and the Health Minister, Kweku Agamang Menu. It is so good to have you with us, Minister. I'm sure you've been listening to the entire meeting, making notes, and you're going to wrap us up beautifully. Over to you.
Thank you, Femi. Let me bring you warm regards from His Excellency, the President of Ghana, Nana Addo Dankwa Akufo-Addo, whose passion for boldly confronting all facets of inequalities motivated Ghana to co-sponsor the 2022 Global Disability Summit. My participation in today's program highlights government's commitment at galvanizing the needed support to ensure that PWDs consistently and systematically enjoy these rights. It is great for us to be engaging on this very important subject on disability. As the world stretches to achieve universal health coverage, it is becoming increasingly clear that we cannot achieve UHC without adequately addressing disability challenges. People with disabilities need to get the quality health services they actually deserve. We have disability inclusion in our health sector as part of our universal health coverage roadmap, which seeks to operationalize the policy aspirations in our National Health Policy 2020. We recognize that there are certain barriers preventing persons with disabilities from receiving health services. This includes assistive technology and mental health services. However, this right is guaranteed under the Convention on the Rights of Persons with Disabilities, which is a legally binding treaty. And this treaty has been signed by most countries. In fact, Ghana has actually put into our statutes, we have an act that is called the Persons with Disability Act of 2006, Act 715. In there, we actually sought to ensure that public properties, buildings, and places like hospitals are easily accessible for people with disabilities. And new facilities that were being put up should actually include these designs, and those old ones should be retrofitted. And I think that has gone on course for the past so many years, since 2016, when that law was actually passed. The barriers that people with disability face relate to the quality of health services they receive, perception of health workers towards them, and attitudes of health workers, among others. In Ghana, we are working on disability inclusion in the health sector as part and parcel of attaining our universal health coverage. We aim to ensure they receive high-quality health services in a timely manner. Some of the practical steps we have taken so far include 34,000 Ghanaians being enrolled on the Quality Rights e-training platform, and 17,000 and over have successfully completed the 15-hour 6-module course to obtain their WHO certification. 627 stakeholders across Ghana have also received intensive face-to-face quality rights training on mental health, human rights, and recovery issues, with more research trainings on the horizon. In addition, 8 of the major mental health facilities in Ghana have undergone quality rights assessments and have gone on to develop service transformation plans to actually address the human rights gaps identified during the assessment phase. These facilities are now in the process of implementing these transformational plans. We have a prosthesis and orthotics center, and we produce some of the assistive technology devices in country to support those living with disabilities. These efforts in Ghana are already bearing their fruits with large and consistent attitude and practice change towards Ghana rights, towards human rights-based approaches in mental health, aligned with the CRPD being seen on a major scale in the country. We also put greater focus on elderly people with disabilities. The lessons of COVID has also taught us that UHC and disability are inseparable. As is often said, never waste a crisis. And as part of our COVID response, our program, we actually provided over 10,000 wheelchairs to all our disability federations in our country. And we have also resourced them to be able to purchase face masks and other essential commodities in the midst of this pandemic. And these are examples of demonstrating government's commitment towards disability inclusion in all the things that we try to do within the health system. We also have a window for them to access affordable access to healthcare services through our health insurance window. And we continue to do a lot of advocacy in this area. I therefore, Femi, on behalf of the President of the Republic of Ghana, entreat all government and non-government stakeholders to carefully study the menu of commitments published on the Global Disability Summit website and sign up to relevant commitments ahead of the deadline 2022, as we have it there. If we all play our parts passionately together, like we are actually aligning with civil society, with our NCD Alliance in Ghana, we know them quite well. They invite us to our programs. We invite them to our programs. Together, we have done our non-communicable diseases policy, which will soon be launched. And I believe when we join ourselves into strategic partnerships, we will build robust and disability-friendly health systems for ourselves, as well as our future generations. I thank you, Femi.
Thank you so much, Minister, for your closing remarks. This pre-summit meeting was brought to you by the governments of Ghana, Norway, the International Disability Alliance, and the WHO. To find out more information about the main event, that is the Global Disability Summit that happens in February, go to this website, globaldisabilitysummit.org. That's globaldisabilitysummit.org. There you'll be able to find an entire 2-hour recording of this very meeting. If you want to rewind it and look at some of the contributions, you can absolutely do that. This pre-summit meeting is now closed. Thank you for joining.
Connect, commit, act. The Global Disability Summit, Thematic Pre-Summit on disability inclusion in the health sector.